Hey everyone, my name is Dr Weigand. I'm a general dentist in Fargo, North Dakota. I've been doing dentistry and orthodontics for a little over 10 years now, and mostly clear aligners, but also some straight wire ortho. But yeah, I really enjoy it, and really enjoy helping patients reach their goals and get the smile of their dreams. Are there any advancements in teeth whitening technology that offer faster or more effective results? The answer is yes. I always tell patients that really the only whitening ingredients are carbamide peroxide and hydrogen peroxide. Hydrogen peroxide is generally considered more effective. Neither are harmful in any way, but definitely can cause some sensitivity and can feel like that it might be doing damage, but it's temporary. And then sometimes in-office treatments they'll use an LED light to kind of accelerate the whitening process, but it's not needed. You can do at-home whitening too, and use a higher concentration of hydrogen peroxide gel and get better results that way. When do I need retainers? And the short answer is always. Teeth have an incredible memory for wanting to move back to the position that they once were in. It's just best if you, whether it's permanent, like a fixed retainer, or removable retainers that you wear at night. It's generally indicated that you always use retainers if you want to keep teeth in the position that you want for aesthetics. What methods are used to measure tooth shade changes before and after whitening treatments? Typically, the shade guides are the most common ways. There are some fancy digital instruments that can be used to measure how much light passes through the layers of the teeth and that sort of thing. Spectrophotometers, but shade guides are the most common way to get a general idea of how many shades you lightened up after a whitening treatment. Can teeth whitening procedures cause pulpitis or other forms of tooth sensitivity? Yes. So we already talked about this, but yes, definitely short term. The best way to alleviate this is just shortening the duration of the whitening or using a lower concentration of peroxide gel. Different types of retainers exert forces to maintain tooth alignment. They don't necessarily, retainers retain the tooth position. Aligners exert forces on teeth. Retainers are more so counteracting forces that the teeth are exerting to try to move back to where they were. So yeah, you're really trying to more so counteract the forces using a retainer. Can digital impressions enhance the accuracy and fit of custom-made retainers compared to traditional methods? Yeah, I mean, digital impressions are great. They have like unbelievable accuracy, more so than impression materials even. So it's yeah, digital scanners, 3D scanners are an excellent option in that regard. What considerations are important when adjusting and fitting retainers to ensure patient comfort and efficiency? Occlusal contacts are important. A lot of this just comes from experience, but keeping that material off of the gum tissue is helpful too, because sometimes as much as we try to smooth that material, if there's a sharp edge somewhere and it's digging into your gums, it's super uncomfortable. Are there any complications associated with long-term retainer wear, such as gingival irritation or enamel demineralization? Yeah, that can be a concern. Particularly with permanent retainers, bonded, the lower bonded retainer is classic for being kind of a hygienic challenge, being difficult to clean around, and some people tend to get buildup down there, and they can irritate the gums. So that part of it, yes. Enamel demineralization, not so much unless you were just not cleaning your tray out, and then you can put things in the tray to in your retainer to or in a whitening tray to help remineralize the teeth, actually. So I would argue that part of it could be even better. Can clear aligners correct rotational or torque movements of teeth as effectively as traditional braces? I've always been amazed at what clear aligners can accomplish. That being said, there's some limitations, and your dentist or your orthodontist can help with some experience, they can kind of help maybe set the stage and prepare you for what those limitations might be. But yeah, there are some limitations to what clear aligners can accomplish. In some cases, patients just aren't a candidate for clear aligners. Just what they need is so complex that they'll have to go the traditional braces route. What factors influence the duration of teeth whitening treatment, and how can treatment timelines be optimized? Yeah, it depends heavily on a lot of different factors. It's always good to start with a cleaning. I'm always amazed at sometimes just, if you're overdue for a cleaning, just getting things cleaned up, getting polished up, how much your teeth will lighten once you get, 6 or 12 or 18 months worth of stain off of your teeth. It can have a profound effect. And then, everyone just responds differently too. Again, like we spoke about earlier, concentration of the peroxide gel is a really important factor, and then how much you can tolerate it too. If you increase the concentration and you start getting so much sensitivity that you just can't tolerate it anymore, then you have to dial it back and maybe do it less often. So there's a lot of factors. But in general, the more time you can spend with the whitening gel on your teeth, the better result you're going to have, and the higher concentration of peroxide that you use too. Can clear aligners be utilized in conjunction with orthodontic surgery to optimize facial aesthetics and occlusal function? Yeah, sometimes, probably more pre-surgical, where you want to try to get the first phase of the orthodontics completed before surgery oftentimes. So sometimes it can be helpful in that instance where maybe before surgery you're wearing clear aligners, and then if you need something after orthodontic surgery, then you may go back into clear aligners, or you may go into conventional braces. What role does patient compliance play in the success of clear aligner therapy? It's everything. It's the most important role. If you don't wear your retainers, or you don't wear your aligners, you're not going to get results. It's as simple as that. And so the more time you spend in aligners, the better and faster result you're going to get. Generally, like 22 plus hours a day is the answer, day and night, all the time, except when you eat. And then eat, brush your teeth, and put them back in. Clean your aligners, and then put them back in. You really have to be wearing them all the time for them to have a benefit. It's one of the advantages of conventional ortho, is that you can't take them off, and for some people that's a good thing. What evidence supports the long-term stability and retention of orthodontic outcomes achieved with clear aligners? There's tons of studies that you could find almost anywhere that kind of prove that clear aligners can be an effective form of treatment. Not always. Again, like I said before, it depends on case complexity, depends on the patient's compliance. There's a lot of factors, but when treated with clear aligners when they're indicated, and typically by someone with some experience, or at least monitored by someone with some experience, and then if you're compliant and you wear them all the time, then they typically work pretty well. So, are there any risk factors associated with self-treatment or DIY clear aligner kits without professional supervision? I always advise to have checkups and to have follow-ups to see what progress is being made, and then if something goes awry through the process, it can be corrected immediately, rather than most people just don't know. You don't know what to look for, and you don't know what you don't know, and so it can be that can be a problem when to not have a follow-up visit. Probably at least monthly, to check and see how things are going. What role do patient demographics, age, skeletal maturity play in determining candidacy for clear aligner treatment? Yeah, both of those play a factor. Age is an important factor for determining whether or not you're a candidate. I mean, there's no age that you're automatically disqualified or anything like that, but typically it's easier to, the younger you are, it's much easier to move teeth when patients are still growing and developing. Sometimes other factors like once you get a little older and, people develop habits of clenching or grinding your teeth and there's excess bone growth, and it makes it more complex. The case becomes more complex. The tooth movements become more complex as things like that happen. What are the limitations of clear aligner therapy in cases of severe crowding or dental arch expansion? Yeah, severe crowding cases can be tricky, and sometimes those cases aren't. You're just not qualified for clear aligner therapy. That's not always the case. Again, like I said, I've always been amazed at what you can accomplish with clear aligner therapy. But sometimes, interproximal reduction is needed. Just taking a really, really thin layer off of enamel in between the teeth, just to create enough space where the teeth can move past one another to move into position. Sometimes having little attachments bonded onto the tooth surface. Sometimes we call them engagers, where you can the tray has more surface area to hold on to have be more efficient, more effective in moving the teeth, to exert a little more force on the tooth to move it into position. Sometimes even extractions are needed to create enough space, and then sometimes it's skeletal, where there's things that need to happen to the bone structure, and those types of things can't really be accomplished with clear aligners, sometimes not even with conventional braces. Sometimes there's other methods that are needed in those cases. What advancements can we expect in the future of teeth whitening, retainer design, clear aligner technology? Yeah, I mean, that's a great question. There's the future is bright, in my opinion. I've always felt like dentistry is sometimes a little behind the curve in advancement, but the last few years, I've just in my time in clinical dentistry, the last 10 years, it's been amazing what digital dentistry, 3D dentistry, it's been amazing seeing the progress that's been made, and it's really exciting to see what's coming. I think there's a couple like nanoparticles, nanomaterials are really exciting. I think lasers are really exciting, and they already do play a role in whitening, and I think maybe even more so in the future. I think there's efforts that have been made and are being made to try to. The biggest downside of whitening is sensitivity, and so I think once someone figures out how to have like really good results with whitening without the sensitivity, that'll be a good day.